Welcome. Hello, everyone. We're just going to wait for everyone to get logged on here. Hello, hello, for those just entering our virtual room. We're excited to see everybody logging on here. We're just going to take maybe another minute and get started. Sometimes it takes a minute to get everybody logged on. Well, I'm going to go ahead and make some quick just introductions as people continue to log on here. We want to get started on time so that we can finish up and you all can get back to the rest of your evening. Thank you so much for joining us. This is, 7 o'clock on what are we, Wednesday night? And you're taking time for yourself, for your family to log on with us here at Skyland Trail. So we so appreciate you creating space for that. I'm Shelby Gutenberger. I'm one of the National Referral Relations representatives here in Atlanta. And I just wanted to do, before we get started, just do a quick overview on Skyland Trail, and then we'll dig into the presentation this evening. But we are a nationally recognized nonprofit. Many of you might know that for mental health treatment organization. We specialize in treating adults and adolescents who have a primary psychiatric diagnosis. And we have residential care and we have day treatment programs as well. We also can support those individuals who might be in recovery from a co-occurring substance use disorder. With our two programs, first for our adult program that we won't be focused on as much tonight since we've got a lot of parents in our virtual room. But at our adult program, just so you know, this is our 37th year. We have four evidence-based psychiatric recovery teams. The recovery teams are CBT, DBT, cognition and first episode and social integration. And then, as I mentioned, we can support those with co-occurring substance use disorder. So dual diagnosis is offered for those clients along with their recovery team. And then what we are going to be focused on tonight, of course, is our adolescents. So we opened in 2019 our adolescent campus in Chamblee, and we treat teens that are 14 to 17. So those that are pretty much high school students who have a primary mood or anxiety disorder. They may have a history of self-harm. And also, we are also, on top of being a primary mental health facility, we're also a primary trauma facility as well. We do work with adolescents that have that secondary mild to moderate substance use. And our two recovery teams on the adolescent side are CBT and DBT. Both of our adult and adolescent clients can directly admit to either residential level of care or day treatment. And that really is dependent upon the level of care that they need, what's clinically appropriate. And we work with our psychiatrist that sits in admissions to determine that level of care after assessment. Um, for those of you that don't know, and people are excited to hear this and happy to hear this, we are in network with private insurances. And that is also TRICARE East, the military insurance, which is actually wonderful coverage for kiddos. And as a nonprofit, we also offer financial needs-based financial assistance to help with families because we know insurance does not cover 100% of services. So we're going to get to the meat of our program, and I would like to introduce Molly Mercer Dedman. She is our Director of Education, and she is going to introduce our two speakers for the evening.
Thank you, Shelby, and welcome everybody. Thanks for being here. I wanted to mention that if you have any questions during the presentation, feel free to put those in the Q&A box, or you can put them in the chat for us, and we will have some time at the end to answer a few questions. So now it's my pleasure to introduce our two speakers. First, we have Piper Coffey. Piper is a licensed clinical social worker. She joined Skyland Trail in October of 2020, and she serves as our Vice President of Adolescent Clinical Services. She oversees our clinical programming for all of our adolescent treatment programs, and she brings extensive experience in adolescent residential psychiatric care. We also have Brandon Baird here. Brandon is Skyland Trail's Assistant Director of Adolescent Family Services. He's also an adolescent family therapist at Skyland. He has experience providing individual, family, and group therapy in community-based settings. He earned his bachelor's degree in sociology from Morehouse and a dual master's degrees in social work and public health from the University of Georgia. So welcome, Piper and Brandon, and thanks everybody for being here.
Thank you, Molly. We're definitely happy to be here. So let's just jump right into it. What we're going to talk about today in parenting and, being confident within parenting first is navigating social media, substance use, and peer pressure. We're also going to talk about those proven strategies that we have seen support teens who are struggling emotionally and, with emotionality on various levels. And we're also going to talk about the warning signs so that you know when to seek professional help. So why are we here? Well, because teen mental health is quite frankly in a crisis. When you think about in 2016 that a quarter of all children in the US have a depressive or anxiety disorder, that is an alarming number. Thinking about 25 to 30 kids being in one classroom, that is around 7 or 8 kids that probably have a depressive or anxiety disorder. Um, Along with that, suicide is the third leading cause of death for teenagers. And this is why help is needed so much and how sometimes so many people don't receive that help. A study by the CDC in 2020 also found that 1 in 3 high school students experience persistent sadness or hopelessness. Um, we still don't have quite have the numbers after the pandemic, but even before the pandemic, this is quite alarming numbers where, when you think about, um, because when you think about just the disorders, these kids may not reach the level of that, but it still means that they need help, as well as 1 in 5 high school students seriously considered suicide, and with female students being twice as likely to make a suicide plan as male students. That doesn't mean they're going to carry it out, but having a plan is a very concerning sign as well. So, what are some of the causes of mental health? One of the first ones is a family history of mental disorders. We have seen that, there are generations of different mental health disorders and diseases, and they carry on for a lot of different reasons. There's also adverse childhood experience. This could be things like trauma. This could be things like deaths in the family, changes in the family, divorce, and sometimes it could just come about. Um, Lastly, some of the causes are social difficulties, stress, and academic pressures. So many of the students that we have come into our facility go into what I call the cycle of anxiety, where they don't do their work, they get stressed about their work, they get a zero for their work, they're more worried about the zeros, and it just starts over and over as that work compiles more and more.
All right, thanks, Brandon, and welcome everyone. Warning signs. So we've talked about some causes, we talked about the data, but what we really want to know about is warning signs. When do we need to be concerned and when do we raise the red flag? So adolescence is hard. We already know that they have immense emotional reactions. They have intensity of reactions to anything that we feel that could be over the normal. So what we like to say is if you are seeing any of these behaviors and it is creating so much dysfunction, interruption, and concern in just the day to day, that's where we need you to say, hey, we need help, or hey, let's check this out. So we start with talking about obsession, about death, openly talking about suicide. You might even find some poems and drawings about death, and as well as increase in defiant behaviors. They might even be acting violently. They've changed the way they dress, their hygiene, their mood. The hygiene might be completely obliterated in terms of they used to be pretty good at it. Of course, we're in the adolescence. Now we're really bad at it. We haven't showered in 3 or 4 days. We haven't brushed our teeth. We have a lot of kids who come in who have been, pretty much living in their room and they have not showered. They have not bathed. They have not just really considered anything about their hygiene as being important due to the level of depression, the level of anxiety, and just the social challenges that all of our kids are facing today. Another big one that we all kind of know about is giving away those belongings. All of a sudden, siblings might have things that they would have fought over. It's like, well, no, Sarah gave it to me, so it's really no big deal. I've always wanted it. And then, of course, we talked about staying away from people and activities, that isolative behavior. Again, during the pandemic, you might have seen a lot more of that. It is continuing. It's, as Brandon was saying, it's not improving. It's not getting better. I think we're still staying at the same type of baseline and maybe even a little worse. All right, Brandon, do I flip it or you flip? Okay. All right. All right. So you see all these concerns. You're like, but I try to talk to my teenager and they're like, shut up, mom. I hate you, or get away, or whatever. You don't care. Absolutely. Brandon and his team are always working with our families on how to be communicative and effective communicative. So, how do we do that? How do we have a conversation with a teen that's really going to listen to us, that's really going to hit home, and we feel like we were able to make a difference? So, validation. We hear validation all the time. Oh, I feel so validated. Thank you so much. But what does that really mean? We're talking about you understanding and expressing acceptance of another person's emotional experience. Let me say that one more time. Understanding and expressing acceptance. That has nothing to do with whether you agree with it or you condone it. It simply says, I hear you. So here's an example. Focus on what your teen feels about it, not about what happened. So they get in the car. Hey, how was your day? Oh my God, Sarah really blew up my whole social media today, blah, blah. Well, what happened? You really want to focus on how that make you feel. And she's like, well, she was my best friend, and now I'm gonna have no friends. Tell me more about that. So you really want to hear what is going on with the feelings and the emotional experience as opposed to dissing, hearing the gossip, give me the tea. This is letting them know that you are validating what they're feeling in the moment. Again, we're not agreeing with it. We're not condoning it. We're not saying this is, you have absolutely the right to feel this way. We're simply wanting to know that we are in the moment. We are validating their experience as they are feeling it. And we want to hear more. We want them to know that we are partnering with them and we're joining with them right this moment.
So, what are some kinds of statements that are invalidating? And these statements are things that we hear a lot within our work. And some of these invalidating statements seem like they sound good when they're really not. Sometimes things like saying life's not fair, well, that's not really helping because you're not really going into the person's emotions. And that's what I really want everybody to focus on is are these statements actually exploring the emotions, or is it saying, no, it doesn't actually matter? Don't make any judgmental statements. Don't tell them that they did something bad, wrong, or anything like that. That's not going to help in the moment. And they will ask you if they need help. One of the biggest things is making sure that you aren't just giving your child advice or lecturing them in these situations, but you're hearing them out. And when they ask for advice or some, comments about what they did, then you can, tell them maybe some things that are better. And another thing is don't try to change the situation by saying, well, this you could have done this. Well, we possibly could have done this, but how's this helping me within the moment? I did this or this happened, therefore I still feel this way. Another common one that also kind of pushes aside someone's emotions and focuses on themselves is when you say, how do you think that makes me feel? Well, they don't really care. They want you to hear how they feel and stop at that point. There may be some times where you can go into it further and then you can show that empathy and some more understanding by saying, oh, yeah, I've been through that and I know how that feels. But dismissing it by saying, how does that make me feel? Oh, no. Don't double down on the situation by saying that you always do this. Once again, it's not helping those situations. It's not focusing on that situation. It's focusing on them as a person. Don't compare siblings. Don't compare cousins. Don't compare anybody. Those are also really, really difficult. Why can't you be like your sister? Well, I'm not, and I am my own person. And make sure you don't label the person. I think these are kind of obvious things, but you'd be surprised how often these things happen. Now, let's see what are some validating statements. I can see that you're very angry. Here's what I hear you saying. That's that active listening where you are listening to them and summarizing exactly what they're saying so they can either correct you or say, yeah, you do understand. Say things, oh, that's really tough, or I know that's really hard for you, or praise them and say, hey, I know this feels this way, but I see you studying well on that test. And the more that you study, that good grade is going to come. One of my favorites is, this is going to be tough. And, a different way to say that is what a tough spot to be in. Saying things are unfair, that is okay. That's not saying life's not fair, but hey, yeah, that was unfair. And, it's really tough that you're being asked to do that. When they may receive some bad news to say, hey, that's really discouraging because that emotion may be really hurtful, or I bet you feel disappointed. And another way to validate and go further within that is using those open-ended questions. And when you use these types of questions, it enables your child to talk more about those situations. Try to stay away from those yes or no questions, because that's going to shut down the conversation really easily. When you ask these kinds of questions, they have to give more detail. Now, you may say that your child may shut down and not say anything. Well, then that is their choice. And even with that, you can say, hey, let me know when you're ready to talk about it, or I'm here for when you want to talk about it. Don't keep pushing the issue because then they may get upset or may say you don't understand me when you're really trying to help. So being careful of how you go about those situations, but still make sure that they know I'm here for you as your parent.
So now we got some tips on how we should have effective communication, reminding ourselves open-ended questions and validating statements. Let's talk about the home. We need structure and boundaries, right? At least we think we do. Now, structure is a big word. I call them umbrella words. It can mean different things to different people. Just like when I think I'm making my bed correctly, my mom's like, no, 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 that's not how it works. So let's talk about when we are talking about structure, we are referring to all of those rules, limits, expectations, norms of communication. When we're saying norms, what does that mean in your family? Everybody's family is different. It means they're going to say things in a different way. We all have our vernacular, our verbiage. We have, cutie two little words. So be mindful of what those are. What are your practices and what are your reactions? I don't know about you, but whenever I knew that I wanted to go do something, I knew to ask my mom in front of her friends because she wasn't going to say no in front of her friends until she did it one time and I was embarrassed and I never did again. So again, structure is important. They need to know when there is time to ask, when there are rules, when the limits, and what are those consequences, reactions, practices going to be as a result of pre-established structure in the home. Routines are my favorite. Traditions, I love them. Routines are great. Even though your kid says they hate it, let me just tell you right now, Brandon, I've been doing this for a long time. And one of the number one things that come up in conversation when we're doing therapy is talking about routines, and kids thrive on that. And it allows us as family members, parents, to be the bad guys. Oh, I don't have to, I can't go because my mom, I've got a curfew at 8:30. And that's our role. So having that schedule for your kid is allowing them to say, I've got to be here and be there within that confine. It's not an open-ended, oh, I can stay out till 2 a.m. Nobody cares about me. It is, no, I have to be here, and by the end of the movie, I've got to get home. But you can still have fun. It doesn't mean, I always like to say, oh, I can never have fun if I'm only going to be there for 2 hours. Do your very best. 2 hours sounds like a great time to have fun. Don't want to get into the power struggle. Don't want to get back to those invalidating statements and things that Brandon was speaking to. Make sure that those limits are within the schedule and they're there to reduce some of those power struggles, maladaptive behaviors, just those common areas where you guys struggle. Computer time, we all know computer time, social media, phone, right? All three of them are the top three. And if you have those pre-established rules, limits, structure, then they already know what it is. So you guys don't have to do the same conversation every day, every hour, every evening. You know that computer time is here. Check that on the fridge. Let me know when you're ready, like Brandon was referring to. Consistency within the weekdays. I like how families, and Brandon can probably tell you more examples. Everything goes out the window after 5 or on the weekends. I don't know how that's going to create structure and routine. And I don't know how your kids are going to know that you really mean it when you mean it. Back in the old days, remember when the mom said, by the time I count to three, did anybody do it on one? No. I waited to three because I knew I had one, two, three. So if we have consistency, that means every time that rule is broken or expectations to do chores, homework, limit my phone time, that's going to allow you to have good quality family time and to practice some of those validating communication styles.
Now, one of my favorite things within setting limits, having structure, making sure you have those boundaries is holding boundaries without saying no. What I like to say is say no without saying no. And, why do we do this? Is because they listen better. In any situation when no is the response, the person just feels dismissed. They may be upset about it. There's something about no that just makes people upset. I'm kind of upset even thinking about saying no. So, with all of that, you have to make sure you use your language in an effective way so that they can understand. Now, don't over explain yourself, but you can say instead of, hey, no chocolate, hey, chocolate before dinner is not healthy. If you eat your green beans, then you can have your chocolate. And there's also making sure that you don't jump on people and jump on your kids when they may say something. That quick reaction does not create that communication and that openness. It really just shuts all that communication down. So when they may say a bad word or they may say something that is not acceptable or norm within your house, rather than saying, don't say that, you can say, hey, can you please choose another word? Something I love using within my sessions, especially when thinking about phrases that people may say, whether it's parents or kids, is, hey, can you reframe that? And it gives them a chance to pause, think, and okay, how can I say this in a better way? Rather than saying, I can't hear you, say, hey, can you please speak louder? Giving them the clear thing that you need rather than saying, hey, don't do that. When you give them the clear explanation of what they need, they are more likely to follow through with what you want. And we know about this electronics. No electronics after bedtime. Making sure that they understand that you care about them and the things that they're interested in. Hey, I know you value your phone time, and would you rather use this time before or after dinner? So it avoids all that conversation about talking about when can I put up my phone or hey, you got to turn my phone in at this time. That's not saying that you don't have those conversations, but it gives them the two options that they get to choose, either before dinner or after dinner, and they get to choose one of those two. And that can be in so many different ways, whether it's, what do you want to eat today? Hey, you can either have this or this. Where do you want to go? Or we can go here or there. Which one, where do you want to go? And allows them to have more input and allows them to feel connected to the things that you're doing as a parent and the decisions that y'all make in a household. Now, there's other ways of setting limits other than saying no. And this is where it comes into play of making sure that you do it in the most effective way so that you don't get a poor response from your kid. I actually had a family the other day where, it's very anxiety inducing for parents to set their limits and, be firm with them. So a mom jumped into our discussion about building up those expectations. Hey, there's not going to be any substance use. You're not going to do this. You're not going to go here. You're not going to go there. You're not going to go here. And it's like, wait a second. We can slow that down and say, hey, this is what the expectation is, and this is what you're going to have to do to earn more privileges to have more freedom. Don't give any ultimatums. Don't tell them, hey, if you don't do this, I'm getting taking everything out of your room. Or if you do this, you're going to get out of my house. No, don't try to go there because they may call your bluff, for one. And the other one, are you really going to follow through with that? Remember that every limit that you set as a parent is something that you have to follow through with. I'll never blame a parent that reinforces things, but make sure you know exactly what you're reinforcing and what you're not reinforcing. The next thing is you got to be clear and concise of what you expect. Don't say, hey, you're not going to have your phone in your bedroom. Say, hey, I need you to turn your phone into me at 9 o'clock. So that way they know exactly what to expect. They know exactly what you expect. And they also know that if I don't do this exact thing, that's where the consequences are going to come into play. However, if you aren't clear and concise with that, that's where you get people that are able to work around different places. And I tell you, these kids these days are very smart and they can work around anything. Explain your decision. Once again, don't over explain, but make sure they know exactly why you're making that decision. Hey, I'm telling you that we need to have your phone at 9 o'clock because I know you haven't been sleeping well. And we know your doctor says you need at least 10 hours of sleep. So let's try to get that. Another thing is to be reasonable and realistic. Part of this goes into what are you willing to do as a parent, as well as what is actually reasonable for an adolescent or someone at any point within their age group. If you're not giving them enough time to be social on their phone, which is a huge component in why electronics are so difficult, it can affect their social life. It can affect the norms that they have within, the current Gen Z ways that they communicate. It's just the way it is. And, being reasonable and realistic doesn't mean that you have to allow them to talk all the time, but allowing them enough time to talk while also telling them, hey, there's limits to everything and be flexible. Don't say this is the line and this is how it's always going to be unless there's a safety issue. Say, hey, the more that you are able to go to bed on time and turn in your phone, the more that you are going to be able to have your phone in your room for a little bit more time, or that I can trust you that you can charge your phone in your room and you're still going to go to sleep. Because we're doing all of these things to make sure that they grow within their independence and make sure that they are able to have their autonomy that as parents we all want our kids to have.
Absolutely. And Brandon was really spot on when we're talking about being flexible. It's compromising. And so when we're talking about modeling, you have to kind of put up or shut up, right? Don't live by the model of do as I say, but not as I do. They want to see that you too are buying into what you're asking them to do. So if you can show appropriate compromise and how to verbally appropriately compromise, then they're going to be more willing to see that you are in it to win it. You hear what they need, and when you say, "I'm concerned about your hygiene, I'm concerned about your sleep, I'm concerned about your social," you really mean it as opposed to simply throwing it out there to create another quote unquote rule. So when we're modeling or we're talking about modeling, it really is what people are doing, what we're doing, and what they're seeing. And I don't know how many times you guys have had an argument or a discussion and they throw it right back in their face. Like Brandon said, these kids are smart. They're elephants. They remember every little thing. I remember the time when you let little Johnny do it, but I can't do it. So again, consistency and reasonable and making sure that's realistic for you, And so when we talk about how to model appropriately and the behaviors that we want to see, some examples are when children are acting appropriately, we make sure we praise them. We call it a pivot because when we tell them no all the time, it's almost like I can't do anything good, so why try? right? And we're simply wanting to reinforce the most basic positive situation they can have. Kids are going through a lot. We all know that. And very rarely do they get that positive reinforcement. Or they feel, and again, it's their feeling, their perception, which doesn't mean it's right or wrong. It's simply what they're going through, that they don't have any way to be successful. When they say, I'll never pass this class, how do we back that up and praise them for the small things that they're doing? Also, when we're talking about some, a little bit more severe behavior, substances, aggressive behaviors, we've had numerous families who tell them, you will not do that. But my goodness, these families are having open cocktail parties, open bars, and doing similar behaviors or asking their children not to do. But then when the child engages in those, exactly what mom and dad are doing, they just rain down on them and start lecturing and yelling. And this is where the whole breakdown happens. And let's go back to the beginning of what we started talking about, those warning signs. Those are warning signs right there. If this child is coming back to you and pointing out that you were doing exactly what we have asked them not to do, we need to take a step back and we need to monitor ourselves and we need to do some self-reflection. Because again, half the battle is us presenting the same type of needs and wants and expectations we're asking our kids of. So show them how to respond to problems. Because again, resiliency is a challenge in this country. We see it all the time, especially with COVID. Instead of showing that our kids could muster through or could go through a very challenging situation, a lot of people just really went into themselves and they were not able to see how to face the weather or persevere or have that support system to say, let's get through this. It doesn't feel good right now, but we can get through this. So by you modeling and showing that you can be resilient and you can persevere and you show how to face a challenge, they learn these things whether you know it or not, which is what we call behavior shaping. So, a lot of you might talk about behavior modification, behavior shaping. What we're doing is we're really pivoting and we're reinforcing some of those small desired behaviors that we want to see that will be the big goal. Now, we don't give away everything. We don't tell them what we're doing. Oh, you're just trying to do that. They might figure it out. And you say, well, if it gets you where you need to be, then I'm happy for you, right? We're all happy. Again, it's all about us helping these children grow, learn, persevere, and problem solve and feel good about themselves. And so by us reinforcing, pivoting, positivity, and saying, hey, I really appreciate you emptying the dishwasher versus, why do you never empty the dishwasher? It's every night, I got to tell you, want, right? So when we're pivoting and we're praising, we make sure we pick the smallest thing out. And we had kids, it could be as small as, thank you for sitting in your seat today. Thank you for asking to get up today. And you would be surprised because they haven't had that much positivity, how it sticks with them. And they'll keep doing it because they want to hear it again. So using that one command at a time and the command that's necessary. Oftentimes we're in a hurry, the world's in a hurry, and we want to put everything in the one basket. Multitasking is the greatest thing, right? Let's all multitask and do 65 things in one sitting. Our kids can't do that, nor should they be expected to do that. Their brains are still growing, they're still developing. So how do we help them hear us? And how do we give them the best opportunity for success? So we only use the commands that are necessary. We only give them one at a time. We're very specific. Look both ways before you cross the street. Again, especially as teenagers grow, they will get you every time if you are not going to be specific. Like Brandon was saying, if you're just simply going to say, okay, well, turn your phone off, before you go to bed. Okay, well, you didn't say I had to turn it into you. You didn't have to say what time I turned it off. I'm in the bed, but I'm not sleeping, right? So we have to be very clear about what our expectations are so they can also understand the needs and we don't set each other up for failure. Statements rather than questions. Hey, would you mind emptying the dishwasher? I don't know any kid that would say yes. Hell, I don't even say yes. Are you kidding me? So, Bob, would you please empty the dishwasher? Um, and then we always want to say what you should do rather than what you shouldn't. Again, it's all about positivity. It's about validating statements, expectations, and we're just building on to all of these type of things we've talked about before, which allows us to shape those behaviors and allows us to see the expectations that we need from our kids and to feel confident as a parent.
All right. Now, I think it's the getting into the thing that a lot of people came for. How do we work with social media? Now, as a family therapist, this is one of the biggest topics that comes up. I talk about it with every single family. I think it's important to talk about it with every single family. And nothing is perfect. You know, it has to be what you need as a family, as well as what is safe for your child. And there are some good things, there's some bad things, and there's some ugly things. But let's start off with the good things. Okay. So, especially when thinking about the pandemic, it really showed how much electronics can really help us within moderation. Now, it's amazing the things that adolescents and children get connected to through everything that they're able to use at the, within the palm of their hand. Almost two-thirds of adolescents support causes or issues that's important to them. They're able to go into those situations. They're able to learn more about life. They're able to learn more about society and care for other people, care for other things. And those are always great things that I know parents want their children to do, is to be able to go out and stand for something and be a part of something. And social media is such an easy way for those things to happen. Now, 80% of teens say that social media helped them feel more connected with their friends. It makes it easier for them to know what's going on. Whether they are close in the same city or if they're friends that they met in camp that live all the way across the world. They're able to stay connected with them, and it makes it easier to be able to do that. And once again, going back to the pandemic, when social life and being around peers were so difficult for everybody and prohibited, this is a way that they were able to stay connected. And then it also, two-thirds of adolescents are able to learn more about more people. They're able to interact with more diverse people. They're able to learn about other cultures. They're able to learn about other countries and other cities and states and how different that they can be. Now, all of these great things are amazing, and they also do come with a little bit of their faults when they are not used correctly.
Yes, so the pandemic gave us some good things and it gave us some really not good things. Here's some data just really emphasizing some of the not so good things that are happening in terms of social media, online, and digital activities. And some of it may not be a surprise. Some of it may be a surprise just in terms of the amount of percentages we're talking about. 54% are watching shows and films on streaming. Brandon, that's me. You're not supposed to put my number on there. Okay. Sorry, guys. Anyway, so we're talking about movies, longer time on social media, doom scrolling, messenger services, podcasts, uploading videos, some not so good videos, video games again, as well as mobile apps. So yes, it's great, the things that we talked about. Moderation is always key in anything and everything we do. This is important for you as parents to know what they're doing. This is where they're going. So instead of simply doing one of those questions like, hey, what you doing over there? Ha ha ha. You know where they're going and you know where you need to be monitoring them and supporting them when things don't go well.
And now here's the ugly that, even though so many teens use social media, they also have a lot of mixed feelings about their social media. It seems like peer pressure, but a little bit more than peer pressure, as so many people rely strictly on social media for communication. I don't get it. They don't use text messaging. I think text messaging is easier, but they rather use Instagram. They'd rather use Snapchat to communicate. And it's very interesting when we see that more than half of the kids that teens in 2018 that actually use social media don't have a positive experience from it. And thinking about almost a third of the kids that do use it do, that's not enough numbers to really justify it as much that they use it. I'm sure there can be good experiences at times for people, but it leads so many, unhealthy behaviors between peers, for those to happen. Bullying has gotten worse. People are able to spread rumors more easily. Whether they're rumors that are false or rumors that are true, it makes it easier to transmit these things. That's why it's so important for you as a parent to know what they're using, who they're talking to, and what they're sending. And there's various apps that can help with that, and nothing helps more than just checking the phone. It also keeps people in contact with people that they shouldn't be around. It continues relationships that may be unhealthy. It sometimes reduces the in-person contact that can happen. One of the expectations that I have with families is, hey, you can use social media for a limited amount of time, but the thing that I say is you got to get out the house at least once and spend time with a peer at least once a week. There's also the way that people look at other people's lives. And this is where it's not just becoming an adolescent issue. This is a person issue, and why social media is so damaging for adolescents. It's because it's so damaging for adults. We have so many unrealistic views of other people's lives. We always say they only show the best part of their lives. The other thing that it causes is distractions and addictions. We call it doom scrolling, but how many of us actually doom scroll? It's almost like it's almost ironic how we say it's doom and we still do it. It's because it's to be able to do that, and these people make these social media, and the way they make social media is so that you do it. One of the things that I've heard is that the top executives in social media companies don't even allow their own children to have social media. It's telling. They know exactly what's going on. They know that it's causing more mental health issues. They know that it's pressuring peers to do things that they don't need to do. And this is all the way from healthy things to trying to dress better, as well as really harmful things such as self-harm, learning how to act out different mental illnesses, and almost embodying these things. One of the other scary parts and the things that people look at the most, because it's those images that we see, is that 87% of women and 65% of men compare their bodies to people on social media. But we don't get the background of how people got those bodies. We don't get the background on it. Are they actually healthy? Or do they have these bodies from something different?
Okay, so here's the meat of the matter. What can you do, right? So a lot of it is really about some of the things we've covered already. And I know it sounds so easy and so simple, and sometimes it is, and sometimes it's not. I think the reason why it might be more challenging is because we've never considered doing these things prior. Talking with Shelby earlier today about a family, it's like, I'm going to have to take my kid's phone away. This will be the first time they've ever had to do that. So can you imagine at 15 or 16, you have to go and physically remove this object that has become their best friend and their connection to everything out of their hand. They don't know what else to do. So let's talk about, again, modeling this behavior. Again, behavior shaping, modeling expectations. Make sure you are practicing not oversharing. Make sure you are not spending so much time all night long on different apps and TikToks and Instagrams and streaming and all those things. Because they're going to say, I see you doing it. Why can you do it? I'm not. And of course, the answer of I'm an adult doesn't really fly anymore. So we need to be mindful that whenever we're asking kids to do something, we need to be willing to do it as well. Also, have you had the conversation around what's private? What do you share with other people? What needs to go out there? Again, we've heard the horror stories. We have seen the horror stories of sexting and sex trafficking, and they're going onto these video game chat boxes and saying, hey, I'm really a 14-year-old. Let's meet up somewhere. What do you do when someone does ask those questions? asked to send nude pictures or asked to tell me more about who you are or to engage in, sexual language. Have you had those conversations before? Again, way back when I was growing up, it was like, how do you have the birds and the bees conversation? It's really more about how do you have conversations with strangers and how to say no when they're asking you very personal questions that doesn't seem to faze anybody these days. Also, ask permission, which I think is a great one. I never even considered it. So thank you, Brendan, for putting this in here. Ask permission from your team if you can post about them. We all feel that way. We go and tell our friends, do not tag me anywhere. Do not put me in there, right? But we've never considered that, oh, maybe my kid doesn't want to be in every post because, again, those things are out there forever. And some of those kids are going to pick up on that and they're going to take it in a way out of context and share it and create stories that are not real. And again, allow them to be bullied or have to defend themselves for really no reason or just didn't even think about it, right? Make sure we also are very intentional when we're having a conversation. We talk a lot about intentionality in our program. We talk a lot about sitting in discomfort because they don't know how to have leisure time without electronics. Our program, we have no electronics. They come in and they learn how to have conversations. They learn how to have idle chit chat. They learn how to introduce themselves and they learn how to give the eye contact. And of course, Brandon probably sure here's lots of situations. Oh, they hate me. Well, let's check those facts. Did you engage in eye contact? Were you fully there? Were you listening intently or you only half heard? Again, they need to learn these skills in order to protect themselves and also to be able to move into the world as an adult. Set those rules for electronics. We talked about being specific. And again, there's other things outside of electronics. Again, it's not easy. It sounds easy, but I think you want us to know. We want you to know setting that aside and really being mindful about having family night, family game night, taking the dog for a walk, or just simply enjoying the sunset. It takes time, and yes, it does. And I think when we talk about what can we do, these are the things we have to do.
Now, some of the other things that you can talk with your kids about is why they're posting about it. Why are they doing this? Why are they doing that? And this helps you as a parent understand just a little bit more about what they're doing. Oh, I'm using Snapchat to communicate with my friends more. Well, okay, so what kind of privacy settings do you have on Snapchat to make sure you're just communicating with your with your peers? How do you make sure that those settings that are always updating aren't actually releasing a little bit too much information that you didn't know that they were releasing? Making sure that the why of what they're actually posting. Are they posting for themselves or are they posting for other people? Are they posting for the likes or are they posting happy to get likes, but they're posting because they're happy to share what they want? And all of those things are really difficult to kind of grapple with at times, especially as an adolescent. But those are the conversations that you have to have and make sure you're being curious by using those open-ended questions that we were talking about earlier. Some of the other things that you can do that are a little bit more specific is have a shared computer area in your home. Don't let them take it to their room. Don't let them, take it outside because not only are you not able to monitor who they're talking to, you're not able to monitor what they're doing. You're not always able to understand what are the new things that are coming about. So many families and parents that come in say, well, my kid has been using this for 2 years and I don't even know what that is. And something I tell the parents is if your kid is using it, you should know how to use it yourself. And go practice it. Go try it out. Create a user and a profile on Discord and Snapchat and whatever there may be. Know how to use it so that you know what the possibilities, the dangers are, as well as some of the things that are good about it, so that you can encourage those things for your adolescent. And the last thing, remove the screens from the bedtime. I know that it's nice to have a TV in the room. I know it's nice to have a tablet and cell phone, but take them away. Um, a lot of adolescents might push back against that and say, I'm really comfortable with my cell phone in my room. And well, what if I'm in danger? It's like, well, if you're in danger, the cell phone ain't going to do anything anyway. I'll tell you that much. As well as, why do you need one of these electronics when you're supposed to be asleep? So put it in a different area. And as a parent, say, hey, we're going to put it all in this area as well. It's not going to be with me either. Making sure that you're modeling that same behavior that you told them, that you want them to follow as well. Now, the last thing, and something I love talking about with all my families, and I promise you, every family, every parent that I come in contact with, I tell them to do this, is to make sure you're taking care of yourself. You can go to therapy. You can attend support groups. Have fun doing the things that you love. I love giving homework to my families. And one of the first homework assignments that I give is I need you to identify something that you want to do, and I need you to go do it. So often, when so many of these problems are having, it can really have a strain on the relationships that you have as parents. Remember, you're not just a parent. You are a human, and your child has to understand that as well. So I sometimes give parents the homework to go out on a date. And sometimes they're like, hey, I don't have the money to go on a date. I was like, well, we all dated and as teenagers, and I know I was broke. We found something to do. So that's not a good excuse. Make sure as a parent that you can be an adult, that you can walk and chew gum. Um, and so I appreciate y'all hearing, this webinar. Piper, anything that you wanted to add about this?
No, I think, again, it sounds really easy, but I want you to know that we do empathize with you and we do understand that these would be significant changes. And any change you can do creates momentum. So don't give yourself a hard time by thinking you got to do everything that we talked about. One step at a time is really what we're asking you to do, to consider, not even to have to do it. So again, thank you for being a part of our webinar this evening and taking time out of your very busy schedule.
Thank you, Piper and Brandon. We do have a few questions that came through the chat that we've got a few minutes to get to those.
Mhm.
The first question is about traditions. Piper, I think you mentioned just the importance of traditions. Can y'all give a few examples of how families can build traditions? What activities can they do with with kids these days having a million activities in the evening? Even just sitting down for dinner all together can be really hard. And so kind of knowing that they're being pulled in a million different directions, what are some ways that we can weave in traditions to family life?
Yeah, I mean, I think when it's already been created for us by simply saying, what is it, Taco Tuesday? It could also be once a month. I know when I was growing up, we would go to this Hungry Fisherman back in Memphis, South Haven, Mississippi, and we would go once a month, and we would go as a family. And of course, we didn't have cell phones, but we knew this was our family night, so nothing was to be planned. And this is the way we're going to do it. And you're here all night. Don't be rushing home to get on the landline or to go out with your friends. This was really our evening to spend as a family. There's a lot of traditions that come around holidays that are very important. It could be that on Thanksgiving we all go to grandma's house, or on one of the Christmas or Hanukkah, we're going to do this at Aunt Susie's house, or everybody's going to bring a small gift, or it could really be just something that you create for your family, you emphasize it, and then you just talk about the importance it is to you. I think traditions are about attaching emotions and memories. So, and the memory is what really, really pushes us along. When you get to be as old as I am, you're like, I want to do that with my family or my grandkids, or I want to just share. And it does make a difference. And I think that's where memories are so important. And I think by you guys creating the tradition, the routine, and then attaching the emotion and the why, and then celebrating that with whomever you do that with, really creates the momentum to say every Taco Tuesday or every Thursday or once a month or whether it be our spring break is gonna go here. So I think that's important.
Thank you for that, Piper. Another question is, do you have some strategies on how parents can set boundaries around technology when teens have to use their phones or their computers for homework? And so they need access to it, but how do you set boundaries there?
Yeah, let me answer this question without getting on my soapbox. But the biggest thing that I talk to my families about is making sure that they have a specific area to where they can do their work. Making sure that they're not doing their homework in their room. I tell adults all the time, if you're working from home, don't do your work in your bedroom. Well, it's the same thing with adolescents. Can disconnect that relaxing time from that work time and making sure it's in areas where, as a parent, you can see and be around, and that you can always monitor and check in on them while they're completing that, as well as giving them time limits, making sure that they're taking those breaks so that they understand that, hey, I know this is tough, as well as you need to be able to um, know how to finish this without procrastinating too long. Now, I know there's so many things that kids can get around, and the kids love going on YouTube and can go here and there, and some things that the school cannot block. Well, one practice that you can connect with that is randomly check the history and let them know that you're going to randomly check that history. And if there's things that are missing between times, then hey, there's something off. And let them know if there's something missing, or if I find something, this is going to affect the time that you have with your cell phone when you don't have to do work. Because if you want to use that school time when you're watching YouTube, well, guess what? You're not going to have that time later. And making sure you're very clear about that expectation that I know the school gave you this computer, but that doesn't mean I got to give you your cell phone or anything else that they may have. And setting it up and being very clear and firm on that boundary, so that they aren't trying to pull any shenanigans, as well as that they're not falling behind in school.
Great. Thank you so much, Brandon. And we'll get one more question before we're at our time. And I'm going to kind of put two of these questions together. But when my teenage daughter comes across as sarcastic or sassy,
Mhm.
or my son and I are arguing constantly and he becomes disrespectful or mocking, so what are the best ways to respond in these moments without escalating the situation further?
Mm, That's a great question.
It is. It's a good one.
Um, so the first thing that I tell parents is you can't take it personal. It's going to hurt at times, but you can't take it personal. When you start diving into your emotions and, as we call, you get into your emotion mind, or you start acting out of those frustrations, it puts you in a place where you're, one, reinforcing that it's okay to act that way, as well as you're not modeling the behavior that you want them to practice. When you show that, hey, that sarcastic remark isn't going to change the boundary and it's not going to change the expectation, they aren't going to come back at you with that. Piper, you want to take the other part?
Yes. So I think once you had those conversations about expectations, limits, and rules and consequences, they're there. It's not, and they know you're not going to be wishy-washy. They're simply trying to bait you.
Yeah.
And I just call it throwing that hook out there, and you can't take the hook because now we're going to just dive off into how you're always so disrespectful. You never listen to me. And then it goes back and forth, back and forth. So again, Brandon's saying, don't take it personal. I know that's hard, but we all know that being a parent is a thankless job. I'm sorry. And also know that if you need to take a break, you can. You can simply let the child know and say, hey, it doesn't sound like this is being very productive at this point in time. I think we need to take a break. Can you hear my clock? Sorry.
No, you're absolutely right with that, Piper.
Well, thank you both so much. And I will pass it over to Shelby to wrap it up for us.
Yeah, thank you all so much. Thank you to Brandon, Piper, Molly. We appreciate y'all being here tonight too. There's a couple other slides there, Brandon. If y'all want to get these QR codes here, and then we just have a couple things coming up we wanted to let you all know about. We have outpatient groups for the first time at Skyland Trail. So we're known as residential and day treatment, and really launching these groups is new and exciting for us. We have a teen wellness academy, and for parents, a group called Parenting as a Process. That group is actually virtual, so you would meet just like this with other parents that may be facing some concerns about an emerging mental health concern for their kiddo. And so we really encourage you to check those out on our website. The address is there, and they are 5-week sessions. So we're excited to announce those. We always like to talk about our 5K. It's one of our, big fundraisers and exciting time of the year. A lot of our adolescents get to participate in this as well, so it's great. We're always looking for volunteers, and it's Saturday, September the 12th. And a couple other things. We always tour. So if you're a mental health professional, and we know that some are tuning in tonight, you can reach out to me directly about touring our facility. And then you can also reach out if you are a parent and want to tour the adolescent campus. You can reach out directly to me too, or our intake team. And Molly, I was going to ask you, is everything that's coming across, is it what I'm putting in the chat, is it coming across to everyone?
If you click everyone, then it will go to everyone. I
Yeah, I
think
don't
some
think I
of
have that option. So, do you mind just putting in the chat intake associates at skylandtrail.org? And that
yes.
will get you in touch with our team at Adolescent to take a tour of our adolescent campus if you are a parent and would like to come and take visit us. And I think that is about it. We would love to continue doing this. And so you all showing up tonight gives us encouragement that parents want this, need this, would enjoy more of it. So we'll look forward to potentially a series in which you'll be able to tune in with us again. And all of our contact information is there. We really appreciate y'all showing up tonight. And take care. Have a great rest of your evening.
Thank you.
Thanks,
Bye.
everybody.